Certified Medication Aide Exam Test Bank, 2026. Question 1. Which does for is not a liquid? A. Emulsions. B. Elixirs. C. Troches. D. Syrups. The correct answer is troches. Question 2. To apply ear drops to a person 3 years of age or older, you A. Instill the drops without pulling the ear. B. Pull the ear down and back. C. Pull the ear upward and back. D. Pull the ear down and forward. The correct answer is pull the ear upward. Question 3. A watery preparation containing suspended particles is A. Lotion. B. Cream. C. Ointment. D. Powder. The correct answer is lotion. Question 4. A drug interaction occurs when A. Person cannot control the ingestion of drugs. B. Withdrawal symptoms occur if the drug is not taken for a certain period. C. The action of one drug is altered by the action of another drug. D. A person begins to need higher dosages to produce the same effects that lower dosages one produced. The correct answer is the action of one drug is altered by the action of another drug. Question 5. You are applying a transdermal patch. A. Cover the patch with plastic wrap. B. Remove the old transdermal path before applying the new patch. C. Discard it in the trash. D. Tell the person the drug is absorbed quickly. The correct answer is remove the old transdermal path before applying the. Question 6. Before giving a drug, you must A. Take the person's pulse. B. Measure the blood pressure. C. Check the care plan. D. Check the allergies. The correct answer is check the allergies. Question 7. Knowledge of what is right conduct and what is wrong conduct is A. Criminal law. B. Civil law. C. Advanced directives. D. Ethics. The correct answer is ethics. Question 8. 1 TSP equals A. 5 ml. B. 30 ml. C. 2 ml. D. 10 ml. The correct answer is 5 ml. Question 9. You are applying topical nitroglycerin. A. Rub or massage the ointment into the skin. B. Check for an old application before applying a new one. C. Apply it in the per area. D. Apply the ointment to an irritated or open area. The correct answer is check for an old application before applying. Question 10. You are not sure of something on a drug order. You should A. Call the pharmacist. B. Tell the nurse. C. Transcribe the order as written. D. Call the doctor. The correct answer is tell the nurse. Question 11. Before giving a suspension, you A. Mix the drug with food. B. Warm the drug. C. Dilute the drug. D. Shake the bottle. The correct answer is shake the bottle. Question 12. You suspect a person is being abused in your facility. You should A. Call the police. B. Tell another med aide. C. Share your concerns with the nurse. D. Tell the social worker. The correct answer is share your concerns with the nurse. Question 13. The intentional mistreatment or harm of another person is A. Malpractice. B. Defamation. C. Abuse. D. Neglect. The correct answer is abuse. Question 14. Controlled substances are A. Left at the person's bedside. B. Kept in a locked cabinet or in a locked drawer. C. Regulated state laws. D. Are kept in the person's drug drawer. The correct answer is kept in a locked cabinet or in a locked. Question 15. Ocular or optic drugs are given into the A. B. Mouth. C. Nose. D. Ear. The correct answer is I. Question 16. Before applying a topical drug, you should A. Provide privacy. B. Expose the person's entire body. C. Treat the person rudely. D. Keep doors and window coverings open. The correct answer is provide. Question 17. As a med aide, you should A. Perform acts that are against your morals or religion. B. Work within the legal limits of your role. C. Perform functions that are beyond the legal limits of your role. D. Function beyond your training limits. The correct answer is work within the legal limits. Question 18. A drug is ordered Q.8.H. The drug should be given A. Daily. B. Every 4 hours. C. 4 times a day. D. Every 8 hours. The correct answer is every 8 hours. Question 19. You are giving liquid drug. A. Return the extra liquid back to the bottle. B. Give cough syrup last. C. Dilute the drug with water. D. Mix all the liquid drugs together. The correct answer is give cough syrup last. Question 20. A doctor begins to give you a telephone order. A. Politely give your name and title and ask the doctor to wait for a nurse. B. Give the phone to a unit secretary. C. Write the order on the MAR. D. Accept the order from the doctor. The correct answer is politely give your name and title and ask the doctor to wait for a nurse. Question 21. When giving oral drugs, you should A. Follow the 6 rights of drug administration. B. Help feed a person. C. Follow the 3 checks of label and MAR check. D. Answer A and C. The correct answer is answer A and C. Question 22. You tell a patient about your personal problems. This is A. Professional sexual misconduct. B. Boundary crossing. C. Boundary sign. D. Boundary violation. The correct answer is boundary. Question 23. You need to give a person 2 different eye drugs. How long should you wait between drugs? A. 60 minutes. B. 24 hours. C. 30 minutes. D. 1 to 5 minutes. The correct answer is 1 to 5 minutes. Question 24. The following statements are about prescription labels. Which is false? A. If a label is not complete, tell the nurse. B. Check the expiration date. C. You may give a drug after the expiration date. D. Always read the label carefully. The correct answer is you may give a drug after the expiration date. Question 25. To prevent infections, you should A. Practice hand hygiene before giving drugs. B. Practice hand hygiene after giving drugs. C. Practice hand hygiene before and after giving drugs. D. Wear gloves when giving an oral drug. The correct answer is practice hand hygiene before and after giving. Question 26. A drug is dropped on the floor. You should A. Dispose of it following agency policy. B. Keep it for yourself. C. Give it to the person. D. Return it to the drug box. The correct answer is dispose of it following agency policy. Question 27. A cone-shaped, solid drug inserted into a body opening is called a foam. B. Tablet. C. Gel. D. Suppository. The correct answer is suppository. Question 28. The purpose of a Nurse Practice Act is to A. Protect the public welfare and safety. B. Protect the safety of nursing assistive personnel. C. Protect healthcare workers. D. Protect the welfare of nursing assistive personnel. The correct answer is protect the public welfare and safety. Question 29. When giving oral drugs, you should A. Mix solid drugs with liquid drugs. B. Stay with the person while he or she takes the drug. C. Place a bottle lid upside down on a clean surface. D. Give liquid drugs before solid drugs. The correct answer is stay with the person while he or she takes the drug. Question 30. Which of the following prevents a tablet from dissolving in the stomach? A. Enteric coating. B. Layering. C. Scoring. D. Granules. The correct answer is enteric. Question 31. You are giving a buccal tablet. The tablet is A. Placed between the cheek and the molar teeth. B. Crushed before you give it to the person. C. Taken with a full glass of water. D. Placed under the tongue. The correct answer is placed between the cheek and the molar teeth. Question 32. To give the right dose, you A. Compare the dose on the pharmacy label against the progress notes. B. Compare the dose on the pharmacy label against the graphic sheet. C. Compare the dose on the pharmacy label against the MAR. D. Compare the dose on the pharmacy label against the Cardex. The correct answer is compare the dose on the pharmacy label against the MAR. Question 33. You made a drug error and need to complete an incident report. You A. Complete the incident report according to facility policy. B. Contact the doctor about the error. C. Give your opinions about why the error occurred. D. Record the error in the progress notes. The correct answer is complete the incident report according to facility policy. Question 34. A drug is ordered. QID. The drug should be given A. Twice a day. B. 3 times a day. C. 4 times a day. D. Daily. The correct answer is 4 times a day. Question 35. Which is used to give a vaginal cream, gel, or foam? A. An applicator provided by the manufacturer. B. Suppository. C. Gloved finger. D. Cotton tip swab. The correct answer is an applicator provided by the manufacturer. Question 36. Drug cart keys should be A. Given to the unit clerk when you enter a person's room. B. Kept with you when you enter a person's room. C. Kept on the cart when you enter a person's room. D. Given to a CNA when you enter a person's room. The correct answer is kept with you when you enter a person's room. Question 37. A severe, life-threatening sensitivity to an antigen is A. Drug reaction. B. Side effect. C. Anaphylaxis. D. Allergic reaction. The correct answer is anaphylaxis. Question 38. When giving a rectal or vaginal drug, you should wear a mask. B. Shoe covering. C. Gloves. D. Eye shields. The correct answer is gloves. Question 39. Vaginal drugs are often given A. Bedtime. B. Before the shower. C. Early afternoon. D. Late afternoon. The correct answer is bedtime. Question 40. You are giving drugs from a drug cart. When you enter a person's room, you A. Ask a CNA to watch the cart for you. B. Leave the unlocked cart in the hallway. C. Wheel the drug cart into the room. D. Lock the cart before entering the person's room. The correct answer is lock the cart before entering the person's room. Question 41. Otic means A. Sublingual. B. Mouth. C. ID. Ear. The correct answer is ear. Question 42. Oral drugs can be given if the person A. is vomiting. B. Unconscious or comatose. C. Able to swallow. D. Risk for aspiration. The correct answer is able to swallow. Question 43. To make sure you have the right person when giving a drug, you use at least A. 3 identifiers. B. 2 identifiers. C. 1 identifier. D. 4 identifiers. The correct answer is 2 identifiers. Question 44. A drug is ordered. PC. This drug is given A. After meals. B. Upon wakening. C. Before meals. D. At bedtime. The correct answer is after. Question 45. Oral drugs are ordered for a person who is comatose. You should A. Notify the doctor. B. Call the pharmacist for IM drugs. C. Ask the nurse what to do. D. Give the drugs as ordered. The correct answer is ask the. Question 46. When applying a topical drug, you do all the following except A. Document before you apply the drug. B. Apply the dose form to clean, dry skin. C. Wear gloves. D. Practice hand hygiene before and after the application. The correct answer is document before you apply the drug. Question 47. When do you record a drug as given on the MAR? A. At once after giving the drug. B. After all drugs are given at the end of the med pass. C. At the end of the shift. D. After the CNA gives the drug. The correct answer is at once after giving the drug. Question 48. A sublingual drug is given A. Under the tongue. B. On the skin. C. Between the cheek and molar teeth. D. In the eye. The correct answer is under the tongue. Question 49. You gave a drug to the wrong person. This is A. Abuse, B. Malpractice, C. Fraud, D. Negligence. The correct answer is negligence. Question 50. Only a portion of a controlled substance is ordered. What should you do with the unused portion? A. Return it to the medicine room. B. Return it to the pharmacy. C. Save the unused portion for the next dose. D. Document and place the unused portion in a designated secure, locked area until it can be appropriately disposed of per facility policy. The correct answer is document and place the unused portion in a designated secure, locked area until it can be appropriately disposed of per facility. Question 51. Taking a person's drugs for your own use is A. Drug diversion. B. Malpractice. C. Boundary crossing. D. Negligence. The correct answer is drug diversion. Question 52. A person has difficulty swallowing his or her drug. You A. Hold the drug. B. Call the pharmacist. C. Tell the doctor. D. Tell the nurse. The correct answer is tell the nurse. Question 53. If you fail to do something that a reasonable and careful person would have done, you are A. Committing libel. B. Fraudulent. C. Abusive. D. Negligent. The correct answer is negligent. Question 54. When giving an eye medication, you A. Apply the drops or ointment to the cornea. B. Give eye drops at room temperature. C. Remove eye secretions by cleaning from the outer to the inner aspect of the eye. D. Tilt the person's head forward. The correct answer is give eye drops at room temperature. Question 55. The nurse asks you to perform a task that is in your job description. You have not done this task before. You A. Refuse to do the task without an explanation. B. Ignore the request from the nurse. C. Tell the nurse you have not done the task before and ask for help. D. Do the task without asking questions. The correct answer is tell the nurse you have not done the task before and ask for help. Question 56. Primary routes of excretion for a drug are A. Secretion into saliva and breast milk. B. Elimination through urine and feces. C. Exhalation from the lungs. D. Evaporation from the skin and nails. The correct answer is elimination through urine and. Question 57. Ear medications are given A. At room temperature. B. After being heated. C. Cold. D. Directly from the refrigerator. The correct answer is at room. Question 58. Drugs should be stored in a refrigerator. A. With fluids. B. Beverages. C. Only for drugs. D. With food. The correct answer is only for drugs. Question 59. A person has an allergy to a drug listed on the mark. You should A. Tell the unit secretary. B. Tell the nurse. C. Call the doctor. D. Give the drug. The correct answer is tell the nurse. Question 60. A prescription label is not complete. You should A. Give the drug. B. Check the expiration date. C. Tell the nurse. D. Call the pharmacy. The correct answer is tell the nurse. Question 61. The basic unit of body structure is the A. Cell. B. Neuron. C. Nephron. D. Ovum. The correct answer is cell. Question 62. The outer layer of skin is called the A. Dermis. B. Epidermis. C. Integument. D. Myelin. The correct answer is epidermis. Question 63. Which is not a function of the skin? A. Provides the protective covering for the body. B. Regulates body temperature. C. Senses cold, pain, touch, and pressure. D. Provides the shape and framework for the body. The correct answer is provides the shape and framework. Question 64. Which allows movement? A. Bone marrow. B. Synovial membrane. C. Joints. D. Ligaments. The correct answer is joints. Question 65. Skeletal muscles A. Are under involuntary control. B. Appear smooth. C. Are under voluntary control. D. Appear striped and smooth. The correct answer is are under voluntary control. Question 66. The highest functions in the brain take place in the A. Cerebral cortex. B. Medulla. C. Brainstem. D. Spinal nerves. The correct answer is cerebral cortex. Question 67. The ear is involved with A. Regulating body movements. B. Balance. C. The smoothness of body movements. D. Controlling involuntary movements. The correct answer is balance. Question 68. The liquid part of the blood is the A. Hemoglobin. B. Red blood cell. C. Plasma. D. White blood cell. The correct answer is plasma. Question 69. Which part of the heart pumps blood to the body? A. Right atrium. B. Left atrium. C. Right ventricle. D. Left ventricle. The correct answer is left. Question 70. Which carry blood away from the heart? A. Capillaries. B. Veins. C. Venules. D. Arteries. The correct answer is arteries. Question 71. Oxygen and carbon dioxide are exchanged A. In the bronchi. B. Between the alveoli and capillaries. C. Between the lungs and pleura. D. In the trachea. The correct answer is between the alveoli and cap. Question 72. Digestion begins in the A. Mouth. B. Stomach. C. Small intestines. D. Colon. The correct answer is mouth. Question 73. Most food absorption takes place in the A. Stomach. B. Small intestine. C. Colon. D. Large intestines. The correct answer is small intestine. Question 74. Urine is formed by the A. Jejunum. B. Kidney. C. Bladder. D. Liver. The correct answer is kidneys. Question 75. Urine passes from the body through the A. Ureters. B. Urethra. C. Anus. D. Nephrons. The correct answer is urethra. Question 76. The male sex gland is called the A. Penis. B. Semen. C. Testis. D. Scrotum. The correct answer is testis. Question 77. The male sex cell is called A. Semen, B. Ovum, C. Gonad, D. Sperm. The correct answer is sperm. Question 78. The female sex gland is the A. Ovary, B. Cervix, C. Uterus, D. Vagina. The correct answer is ovary. Question 79. The discharge of the lining of the uterus is called A. Endometrium, B. Ovulation, C. Fertilization, D. Menstruation. The correct answer is menstruation. Question 80. The immune system protects the body from A. Low blood sugar, B. Disease and infection, C. Loss of fluid, D. Stunted growth. The correct answer is disease. Question 81. The endocrine glands secrete A. Hormones, B. Mucus, C. Semen, D. Insulin. The correct answer is hormones. Question 82. Skin absorption of drugs is enhanced in infants. This is because their skin, A. is thinner, B. has more water, C. is dry, D. has fewer hair follicles. The correct answer is thinner. Question 83. You are giving drugs to an older person. Which of the following may enhance skin absorption? A. Thin skin, B. Dry skin, C. Wrinkled skin, D. Decreased blood flow to the skin. The correct answer is thin skin. Question 84. A tablet is too large for a person to swallow. With the nurse's permission, you can A. crush the tablet and mix it with food, B. give the liquid form of the same drug, C. ask the person to chew the tablet, D. dissolve the drug in water. The correct answer is crush the tablet and mix. Question 85. Before giving a chewable tablet, you should A. taste the drug, B. ask about the person's saliva flow, C. mix the drug with food, D. ask about loose teeth. The correct answer is ask about loose. Question 86. These statements are about gastrointestinal absorption of drugs in older persons. Which is false? A. Gastric acid secretion increases, B. Stomach emptying is slower, C. GI mobility is slower, D. Blood flow to the stomach and intestines is decreased. The correct answer is gastric acid secretion increases. Question 87. Drugs are given orally to an older person. The person is at risk for the following except A. enzymes, B. ulcers, C. constipation, D. diarrhea. The correct answer is enzymes. Question 88. Drug distribution is likely to be greater in A. infants, B. persons with liver disease, C. persons with kidney disease, D. older persons. The correct answer is infant. Question 89. In persons with liver or kidney disease, you should expect drug dosages to be A. increased, B. decreased, C. within the normal range, D. half the normal range. The correct answer is decreased. Question 90. Therapeutic drug monitoring is done to measure A. metabolites, B. enzymes, C. a drug's concentration and body fluids, D. drug toxicity. The correct answer is a drug's concentration and body fluids. Question 91. You assist the nurse with therapeutic drug monitoring by measuring A. vital signs and urine output, B. gastric pH, C. blood pH, D. drug blood levels. The correct answer is vital signs and urine output. Question 92. The following are used to give oral drugs to children except A. medicine cups, B. oral droppers, C. oral syringes, D. pacifiers. The correct answer is pacifier. Question 93. A child cannot swallow a capsule. With the nurse's permission, you can A. sprinkle the contents onto small amounts of applesauce, jelly, or pudding, B. sprinkle the contents into a flavored drink, C. dilute the capsule following the manufacturer's instructions, D. have the child chew the drug. The correct answer is sprinkle the contents onto small amounts of applesauce, jelly, or pudding. Question 94. From birth through the teenage years, children should not be given A. Tylenol, B. Advil, C. penicillin, D. aspirin. The correct answer is aspirin. Question 95. When giving drugs to an infant, you should A. support the child's head, B. let the child choose which drug to take first, C. place a tablet near the back of the child's tongue, D. use a straw if the drug can stain teeth. The correct answer is support. Question 96. To remove an unpleasant aftertaste, you should let the child A. have candy, B. rinse with a flavored drink, C. choose which drug form to take, D. choose where to take the drug. The correct answer is rinse with a flavored drink. Question 97. Which is a useful reminder for when to take drugs? A. medicine cup, B. oral dropper, C. oral syringe, D. drug organizer. The correct answer is drug organizer. Question 98. A tablet is scored. What does scored mean? A. You keep track of the number of tablets given to the person, B. the tablet can be broken in half, C. a score means 20. There are 20 doses in the tablet, D. the tablet is time released. The correct answer is the tablet can be broken in half. Question 99. A pregnant woman should do the following except A. try non-drug treatments before trying drugs, B. take only drugs ordered by the doctor, C. have one alcoholic drink a day, D. take prescribed drugs after the infant is done breastfeeding. The correct answer is have one alcoholic drink a day. Question 100. The brand name of a drug is A. its trade name, B. a chemical structure, C. the common name, D. the name listed by the FDA. The correct answer is its trade name. Question 101. A prescription drug A. affects one body system, B. has one use, C. needs a doctor order, D. is not approved for use by the FDA. The correct answer is needs a doctor order. Question 102. OTC drugs A are called recreational drugs. B are sold without a prescription. C have no therapeutic use. D require the phrase Rx only on the label. The correct answer is are sold without a prescription. Question 103. Drugs act in the human body by A. forming a chemical bond within specific sites. B. creating new body responses. C. reconstituting a body fluid. D. diluting a body fluid. The correct answer is forming a chemical bond within specific sites. Question 104. The process by which the body inactivated a drug is called A. absorption. B. distribution. C. metabolism. D. excretion. The correct answer is Question 105. A drug is given by the enteral route. You know that the drug is given A. into a vein. B. into a muscle. C. beneath the skin. D. into the GI tract. The correct answer is into the GI. Question 106. The nurse tells you that the blood level of a drug is too high. You know that the A. person is taking illegal drugs. B. person is at risk for high toxicity. C. the rate or absorption is low. D. the rate of excretion is high. The correct answer is person is at risk for high toxicity. Question 107. Most drugs are metabolized A. in the kidneys. B. by white blood cells. C. by the GI tract. D. in the liver. The correct answer is in the liver. Question 108. Most drugs leave the body through A. the skin. B. the lungs. C. saliva. D. urine and feces. The correct answer is urine and. Question 109. Which is life-threatening? A. an allergic reaction. B. an adverse drug reaction. C. an idiosyncratic drug reaction. D. an anaphylactic reaction. The correct answer is an anaphylactic reaction. Question 110. A person complains of severe itching. You observe raised, irregular patches on the person's skin. This is called A. a side effect. B. an adverse drug reaction. C. anaphylaxis. D. hives. The correct answer is hives. Question 111. A hypersensitivity to a drug is called A. an allergic reaction. B. an adverse drug reaction. C. side effect. D. an anaphylactic reaction. The correct answer is an allergic reaction. Question 112. Which has no active ingredients? A. IMB for. C. subcutaneous. D. placebo. The correct answer is placebo. Question 113. A person needs higher dosages of a drug to produce the same effects that lower dosages once gave. This is called A. tolerance. B. dependence. C. cumulative effect. D. drug interaction. The correct answer is tolerance. Question 114. When checking drug information you must use A. the PDRB package insert. C. the most current resource. D. online resources. The correct answer is the most current resource. Question 115. A single drug order is given A. at once. B. as needed. C. at a certain time. D. at bedtime. The correct answer is at a certain time. Question 116. Which abbreviation is on the do not use list? A. QDB, PC, ACD, Q6H. The correct answer is QD. Question 117. Which abbreviation is safe to use? A. CCB, UC, QODD, ML. The correct answer is ML. Question 118. A drug order state to give the drug if the person has not had a bowel movement for 3 days. Where will you find information about the drug order? A. the Cardex. B. graphic sheet. C. progress notes. D. care plan. The correct answer is the Cardex. Question 119. You gave a PRN drug as directed by the nurse. Besides the MAR, where should you record giving the drug? A. the Cardex. B. graphic sheet. C. progress notes. D. care plan. The correct answer is progress notes. Question 120. When is a copy of the order sent to the pharmacy? A. as soon as it is written. B. after it is transcribed. C. at the end of the shift. D. at the time noted by the doctor. The correct answer is after it is transcribed. Question 121. After transcribing a drug order, you should do the following except A. place a check mark by the order. B. write noted or posted on the order. C. sign, date, and time the order. D. give the drug. The correct answer is give the drug. Question 122. A drug is given daily. What time should you put on the MAR? A. 0900. B. the agency's standard time for a drug given daily. C. the time the drug was ordered. D. the time preferred by the person. The correct answer is the agency's standard time for a drug given daily. Question 123. A drug order was changed from daily to twice a day. When transcribing the new order to the MAR, you should do the following except A. erase the first order. B. discontinue the first order. C. put an X through every date and time not included in the order. D. transcribe the new order on a new line. The correct answer is erase the first order. Question 124. A drug is dispensed in a pact for each drug ordered. This is done with the A. floor stock system. B. individual prescription order system. C. unit dose system. D. narcotic control system. The correct answer is unit dose system. Question 125. The pharmacy sends a 3 to 5 day supply of an ordered drug to the nursing unit. This is done with the A. floor stock system. B. individual prescription order system. C. unit dose system. D. computer controlled dispensing system. The correct answer is individual prescription order system. Question 126. A narcotics count is required A. At the end of the shift B. Every week C. Every month D. Whenever a dose is removed. The correct answer is at the end of the Question 127. To receive oral drugs, the person must be able to A. State his or her name B. Identify the drug C. Sit in Fowler's position D. Swallow. The correct answer is swallow. Question 128. Oral drug orders are written as follows. Which should you question? A. 10 ml B. 10 ml per OSC. 10 ml orally D. 10 ml by mouth. The correct answer is 10 ml per OS. Question 129. Which dose form contains granules? A. Tablet B. Capsule C. Time-release capsule D. Lozenge. The correct answer is time-release. Question 130. Which form is held in the mouth to dissolve? A. Tablet B. Capsule C. Time-release capsule D. Lozenge. The correct answer is lozenge. Question 131. Another name for a lozenge is A. Elixir B. Emulsion C. Troche D. Suspension. The correct answer is troche. Question 132. Which is not a liquid dose form? A. Elixir B. Emulsion C. Lozenge D. Syrup. The correct answer is lozenge. Question 133. Which dose form should you shake before pouring the drug? A. Suspension B. Timed release capsule C. Elixir D. Syrup. The correct answer is suspension. Question 134. Which has a hollow rubber ball at one end? A. Souffle cup B. Medicine cup C. Medicine dropper D. Oral syringe. The correct answer is medicine dropper. Question 135. A person has 4 drugs ordered for 0900. Which should you give first? A. The liquid drug B. A drug in a unit dose package C. A solid drug D. The most important drug. The correct answer is the most important drug. Question 136. Before giving a person a solid dose form, you should have the person A. Eat some food B. Drink a small amount of water C. Drink a full glass of water D. Tilt his or her head back. The correct answer is drink a small amount. Question 137. Topical drug absorption is affected by the following except A. The time of application B. How long the drug is in contact with the skin C. Skin thickness D. Amount of water in the tissues. The correct answer is the time of application. Question 138. A topical drug is applied to debride a wound. Debriding is done to A. Relieve itching B. Provide a protective barrier to the skin C. Reduce inflammation D. Promote healing. The correct answer is promote healing. Question 139. Which of the following do you shake and has watery preparation? A. Cream B. Lotion C. Ointment D. Powder. The correct answer is lotion. Question 140. Lotions are used for the following reasons except A. Absorb moisture B. Soothe and protect the skin C. Relieve itching D. Cleanse the skin. The correct answer is absorb moisture. Question 141. Which topical dose form is dabbed on? A. Cream B. Lotion C. Ointment D. Powder. The correct answer is lotion. Question 142. These statements are about applying powder. Which is false? A. You shake or sprinkle powder onto the person B. Powder is applied in a thin layer C. Powder is slippery and can cause falls D. After applying powder you smooth over the area for even coverage. The correct answer is you shake or sprinkle powder onto the person. Question 143. Before applying a topical dose form, always A. Provide for the person's privacy B. Follow isolation precautions C. Shave the application site D. Clip hair at the application site. The correct answer is provide for the person. Question 144. An ointment is in a jar. What should you use to remove the amount ordered? A. Your hand B. A sterile tongue blade C. A syringe D. A measuring spoon. The correct answer is a sterile tongue blade. Question 145. These statements are about nitroglycerin ointment and transdermal drug delivery systems. Which is false? A. An old application is removed before applying a new one B. You rub or massage the ointment into the skin C. The application site is rotated D. The drug is applied to the skin site with little or no hair. The correct answer is you rub or massage the ointment into the skin. Question 146. Which is used to measure the ordered dose of nitroglycerin ointment? A. A measuring spoon B. Medicine cup C. Dose measuring paper D. Transdermal patch. The correct answer is dose measuring paper. Question 147. Eye drops are ordered. You should use A. A syringe B. A dropper from the supply cart C. The dropper supplied by the drug manufacturer D. A squeeze bottle. The correct answer is the dropper supplied by the drug manufacturer. Question 148. Which is not a position for giving eye medications? A. Supine B. Sitting C. Fowler's D. With the head over the edge of the mattress. The correct answer is with the head over the edge of the mattress. Question 149. A drug order states that a medication is to be given OS. What should you do? A. Give the drug to the left eye B. Give the drug to the right eye C. Give the drug to both eyes D. Check with the nurse. The correct answer is check with the nurse. Question 150. After an eye ointment is applied, the person should A. Wipe eye B. Rub eye C. Close the eyes gently D. Stare straight ahead. The correct answer is close the eyes gently. Question 151. Ear medications are given A. Cold B. At room temperature C. After being heated D. Directly from the refrigerator. The correct answer is at room temperature. Question 152. What should you do to remove excess cerumen? A. Tongue blade B. Cotton-tipped applicator C. Gauze and saline D. Wet washcloth. The correct answer is wet washcloth. Question 153. To instill a drug means to give A puff by squeezing a tube B. A spray by squeezing a container C. It drop by drop D. It in a strip fashion. The correct answer is it drop. Question 154. Ear drops are ordered for both ears. How long should you wait before giving ear drops in the second ear? A. No waiting is required B. 1 to 5 minutes C. 5 to 10 minutes D. 10 to 15 minutes. The correct answer is 5 to 10 minutes. Question 155. You inserted a cotton pledget after giving ear drops. How long should it remain in place? A. 1 minute B. 5 minutes C. 10 minutes D. 15 minutes. The correct answer is 15 minutes. Question 156. After receiving nose drops, how long should a patient remain in supine position? A. 1 minute B. 5 minutes C. 10 minutes D. 15 minutes. The correct answer is 5 minutes. Question 157. Which is the best position for giving nasal spray? A. Supine B. Side lying C. Fowler's D. With hand over the edge of the mattress. The correct answer is Fowler's. Question 158. To give a nasal spray, you give a puff of spray as the person A. blows his or her nose B. Takes a deep breath C. Exhales deeply D. Holds his or her breath. The correct answer is takes a deep breath. Question 159. Before a person uses a MDI spacer, you should A. Squeeze the dispensing valve to remove foreign objects B. Shake the MDI and spacer C. Ask the person to inhale D. Have the person rinse out his or her mouth with water. The correct answer is shake the MDI and spacer. Question 160. The mouthpiece of an MDI spacer is A. Placed 1 to 2 inches in front of the person's mouth B. Placed 3 to 4 inches in front of the person's mouth C. Positioned on the person's lips D. Placed in the person's mouth. The correct answer is placed in the person's mouth. Question 161. After using the MDI, the person does the following except A. Holds his or her breath for about 10 seconds B. Exhales slowly through the mouth C. Inhales more puffs immediately D. Rinses the mouth with water if a corticosteroid was inhaled. The correct answer is inhales more puffs immediately. Question 162. A cone-shaped, solid drug that is inserted into a body opening is called a tablet B. Foam C. Gel D. Suppository. The correct answer is suppository. Question 163. For vaginal suppositories, the client should be in an underscore position A. Lithotomy position B. Sims position C. Left side lying position D. Supine position. The correct answer is lithotomy position. Question 164. After receiving a vaginal drug, the woman is positioned in A. Lithotomy position B. Sims position C. Left side lying position D. Supine position. The correct answer is supine. Question 165. To protect garments and bed linens after giving a vaginal drug, you can A. Apply a perineal pad of panty shield B. Place a waterproof pad under the buttocks C. Elevate the woman's hips on pillows D. Ask the woman to use a bedpan or toilet. The correct answer is apply a perineal pad of panty shield. Question 166. To give a rectal drug, the person is positioned in A. Lithotomy position B. Sims position C. Right side lying position D. Supine position. The correct answer is Sims position. Question 167. Rectal suppositories usually melts in A. 5 to 10 minutes B. 15 to 20 minutes C. 20 to 25 minutes D. 25 to 30 minutes. The correct answer is 15 to 20 minutes. Question 168. A rectal suppository can be given A. For fever B. After rectal surgery C. After prostate surgery D. If the person has diarrhea. The correct answer is for fever. Question 169. Which is used to give a rectal suppository? A. A gloved finger B. An applicator provided by the manufacturer C. A cotton-tipped applicator D. Enema tube. The correct answer is a gloved finger. Question 170. Nerve signals or impulses are caused by A. Neurons B. Synapses C. Agonists D. Neurotransmitters. The correct answer is neurotransmitters. Question 171. Which is not an adrenergic agent? A. Levodopa B. Dopamine C. Epinephrine D. Norepinephrine. The correct answer is levodopa. Question 172. Most adrenergic agents cause A. Vasoconstriction B. Vasodilation C. Bronchospasm D. Hypotension. The correct answer is vasoconstriction. Question 173. Beta-blocking agents are commonly used to treat A. Hypotension B. Hypertension C. Vasoconstriction D. Respiratory disorders. The correct answer is hypertension. Question 174. When giving a beta blocker, you assist with assessment by A. Measuring heart rate and blood pressure B. Observing the color of urine C. Asking the person to use a pain rating scale D. Observing the person's level of alertness. The correct answer is measuring heart rate and blood pressure. Question 175. Cholinergic agents are used in the treatment of A. Myocardial infarction, B. Parkinson's disease, C. Myasthenia gravis, D. Heart failure. The correct answer is myasthenia gravis. Question 176. Anticholinergic actions include the following except A. Increasing the heart rate, B. Drying respiratory secretion, C. Increasing GI mobility, D. Dilating the pupil. The correct answer is increasing GI mobility. Question 177. Which of the following drugs is an anticholinergic? A. Carvedilol, Coreg, B. Terbutaline, Brethine, C. Bethanechol, Urecoline, D. Atropine, atropine sulfate. The correct answer is atropine, atropine sulfate. Question 178. When giving an anticholinergic agent, you assist with assessment by A. Measuring heart rate and blood pressure, B. Observing the color of urine, C. Asking the person to use a pain rating scale, D. Observing the person's level of alertness. The correct answer is measuring heart rate and blood pressure. Question 179. Sedative hypnotic drugs are used to A. Produce sleep, B. Dry respiratory secretions before surgery, C. Decrease drooling and tremors, D. Stimulate the central nervous system. The correct answer is produce. Question 180. All of the following are barbiturates except A. Phenobarbital, luminol, B. Pentobarbital, nembutal, C. Secobarbital, seconal, D. Flurazepam, Dalmane. The correct answer is flurazepam. Question 181. The benzodiazepines are used for the following reasons except A. To dry respiratory secretions, B. Produce mild sedation, C. Produce sleep, D. Preoperative sedation. The correct answer is to dry respiratory secretions. Question 182. The following are benzodiazepines except A. Zolpidem, Ambien, B. Lorazepam, Ativan, C. Estazolam, Prosom, D. Triazolam, Halcion. The correct answer is Zolpidem, Ambien. Question 183. Which drug is not used to promote sleep? A. Chloral hydrate, aquachloral, B. Diphenhydramine, Benadryl, C. Zolpidem, Sonata, D. Carbidopa, Levodopa, Cymit. The correct answer is carbidopa, levodopa, Cymit. Question 184. Which is a common side effect of drugs used to treat Parkinson's? A. Drooling, B. Rigid, stiff muscle, C. Orthostatic hypotension, D. Tremors. The correct answer is orthostatic hypotension. Question 185. Signs and symptoms of Parkinson's are caused by a deficiency of A. Levodopa, B. Dopamine, C. Carbidopa, D. Norepinephrine. The correct answer is dopamine. Question 186. The following drugs are used to treat Parkinson's except A. Pramipexole, Murapex, B. Ropinirole, Requip, C. Secobarbital, Seconal, D. Selegiline, Eldepril. The correct answer is Secobarbital. Question 187. Drugs used to treat Parkinson's: A. Depress the CNS, B. Increase the amount of dopamine available to brain cells, C. Cure the disease, D. Inhibit the use of dopamine. The correct answer is increase the amount of dopamine available to brain. Question 188. A state of severe mental impairment is called A. Anxiety, B. Depression, C. Mood disorder, D. Psychosis. The correct answer is psychosis. Question 189. Many of the drugs used to treat mental disorders affect the A. CNS, B. Endocrine system, C. Respiratory system, D. Cardiovascular system. The correct answer is CNS. Question 190. Which of the following are used to treat anxiety? A. Benzodiazepines, B. Monoamine oxidase inhibitors, C. Selective serotonin reuptake inhibitors, D. Antimanic agents. The correct answer is benzodiazepines. Question 191. The following drugs are used to treat anxiety except A. Alprazolam, Xanax, B. Diazepam, Valium, C. Clorazepate, Tranxene, D. Fluoxetine, Prozac. The correct answer is fluoxetine. Question 192. The following drugs are used to treat anxiety except A. Hydroxyzine, Vistaril, B. Paroxetine, Paxil, C. Hydroxyzine, Atarax, D. Fluvoxamine, Lavox. The correct answer is paroxetine. Question 193. Which of the following is used to produce sedation before surgery? A. Hydroxyzine, Vistaril, B. Chlordiazepoxide, Librium, C. Lorazepam, Ativan, D. Clorazepate, Tranxene. The correct answer is hydroxyzine, Vistaril. Question 194. Mood disorders are treated with A. Anti-anxiety meds, B. Antidepressants, C. Antipsychotic, D. Sedative hypnotics. The correct answer is antidepressants. Question 195. Which of the following have severe side effects when taken with aged cheese and other foods? A. Monoamine oxidase inhibitors, B. Tricyclics, C. Selective serotonin reuptake inhibitors, D. Benzodiazepines. The correct answer is monoamine oxidase inhibitors. Question 196. The last dose of an MAOI is usually given no later than A. 1400 B. 1600 C. 1800 D. 2000. The correct answer is 1800. Question 197. What is the most common side effect of an MAOI? A. Orthostatic hypotension. B. Sedation. C. Insomnia. D. Mouth dryness. The correct answer is orthostatic. Question 198. Which of the following is an MAOI? A. Doxepin. B. Fluoxetine. C. Sertraline. D. Phenelzyme. The correct answer is phenelzyme. Question 199. Selective serotonin reuptake inhibitors are used to treat A. Anxiety. B. Depression. C. Bipolar disorder. D. Schizophrenia. The correct answer is depression. Question 200. How long does it usually take to see the effects of SSRIs? A. 1 week. B. 1 to 2 weeks. C. 2 to 4 weeks. D. 4 to 6 weeks. The correct answer is 2 to 4. Question 201. Which is an SSRI? A. Sertraline. B. Amitriptyline hydrochloride. C. Phenelzyme. D. Doxepin. The correct answer is sertraline. Question 202. Which is not an antidepressant? A. Bupropion hydrochloride. B. Mirtazapine. C. Buspirone. D. Trazodone hydrochloride. The correct answer is buspirone. Question 203. Which is an antimanic agent? A. Lithium carbonate. B. Paroxetine. C. Fluoxetine. D. Sertraline. The correct answer is lithium. Question 204. Antimanic agents are used to treat A. Psychosis. B. Bipolar disorder. C. Anxiety. D. Depression. The correct answer is bipolar. Question 205. The full effect of antimanic agents are usually seen in A. 5 to 7 days. B. 7 to 14 days. C. 10 to 21 days. D. 6 months. The correct answer is 10 to 21 days. Question 206. Lithium can cause a loss of A. Sodium. B. Calories. C. Protein. D. Potassium. The correct answer is sodium. Question 207. The most common psychotic disorder is A. Hallucinations. B. Delusion. C. Schizophrenia. D. PTSD. The correct answer is schizophrenia. Question 208. Antipsychotic drugs often cause A. Involuntary muscle movements. B. Severe hypertension. C. Suicidal actions. D. Sedation. The correct answer is involuntary muscle. Question 209. The following are antipsychotic agents except A. Diazepam. B. Chlorpromazine. C. Prochlorperazine. D. Haloperidol. The correct answer is diazepam. Question 210. A body part may jerk. The person does not lose consciousness. This is A. Epilepsy. B. Partial seizure. C. Generalized seizure. D. Petit mal seizure. The correct answer is partial seizure. Question 211. Anticonvulsant drugs control seizures by affecting A. Neurons in the brain. B. Nerves in the central nervous system. C. Voluntary muscles. D. Involuntary muscles. The correct answer is neurons in the brain. Question 212. Seizure treatment must always contain A. Anticonvulsant therapy. B. Benzodiazepines. C. The cause of the seizures. D. Treatment of epilepsy. The correct answer is the cause. Question 213. Which is a benzodiazepine? A. Diazepam. B. Ethatoine. C. Phenytoin. D. Ethosuximide. The correct answer is diazepam. Question 214. When giving a benzodiazepine you must A. Give the drug with food or milk. B. Provide for safety. C. Give good oral hygiene. D. Measure blood pressure. The correct answer is provide. Question 215. Succinamides are given A. With food or milk. B. At bedtime. C. Before meals. D. After meals. The correct answer is with food or milk. Question 216. Before giving carbamazepine, you A. Measure blood glucose. B. Give good oral hygiene. C. Measure weight. D. Give the person food. The correct answer is measure. Question 217. When giving most anticonvulsants, you observe the following except A. The person's speech pattern. B. Urine color. C. Degree of alertness. D. Orientation to the person, time, and place. The correct answer is urine color. Question 218. Which drug's dosage is based on the person's body weight? A. Valproic acid. B. Diagabine. C. Topiramate. D. Zonisamide. The correct answer is valproic acid. Question 219. Which are given to reduce fever? A. Opiate agonists. B. Salicylates. C. Methadone-like derivatives. D. Opiate partial agonists. The correct answer is salicylates. Question 220. The following are opiate agonists except A. Codeine and morphine sulfate. B. Oxycontin and Percodan. C. Talwin and Darvon. D. Dilaudid and Demerol. The correct answer is Talwin and Darvon. Question 221. Which are the strongest antilipemic drugs? A. Bile acid binding resins. B. Fibric acid. C. Statins. D. Zacia and Omicor. The correct answer is statins. Question 222. Common side effects of antilipemic drugs are A. Chest pain. B. Nausea. C. Hypotension. D. Dizziness. The correct answer is nausea. Question 223. In a normal cardiac cycle, the impulse starts in the A. Atria. B. SA node. C. AV node. D. Bundle of His. The correct answer is SA node. Question 224. Another term for dysrhythmia is A. Arrhythmia. The correct answer is Question 225. Which dysrhythmia has more P waves than QRS complexes? A. Sinus tachycardia. B. Premature atrial contraction. C. Atrial flutter. D. Atrial fibrillation. The correct answer is atrial flutter. Question 226. Dysrhythmia that develop above the bundle of his are called A. Sinus dysrhythmias. B. Premature contractions. C. Junctional rhythms. D. Supraventricular dysrhythmias. The correct answer is supraventricular. Question 227. Ventricular dysrhythmias develop A. in the SA node. B. in the AV node. C. above the bundle of his. D. below the bundle of his. The correct answer is below the bundle of his. Question 228. Which is not considered life-threatening? A. Atrial fibrillation. B. Premature ventricular contraction. C. Ventricular tachycardia. D. Ventricular fibrillation. The correct answer is atrial. Question 229. Intranasal corticosteroids are given to A. liquefy secretions. B. ease breathing. C. reduce sedation. D. reduce inflammation. The correct answer is reduce inflammation. Question 230. Intranasal corticosteroids are given to treat A. common cold. B. emphysema. C. allergic rhinitis. D. rhinitis medicamentosa. The correct answer is allergic rhinitis. Question 231. Intranasal corticosteroids are given to reduce the following except A. nasal burning. B. itching. C. rhinorrhea. D. sneezing. The correct answer is nasal. Question 232. Which liquefy mucus? A. Anti-inflammatory. B. Antitussive. C. Bronchodilators. D. Expectorants. The correct answer is expectorants. Question 233. Bronchodilators are given to A. promote a productive cough. B. ease breathing. C. liquefy secretions. D. dry secretions. The correct answer is ease breathing. Question 234. A person has other drugs ordered with the antacids. The drugs are given A. with the antacids. B. 30 minutes before. C. 30 minutes after. D. 1 hour before or 2 hours after. The correct answer is 1 hour before or 2 hours. Question 235. An antacid is high in sodium and should observe for signs and symptoms such as A. heart failure. B. diabetes. C. asthma. D. urinary retention. The correct answer is heart failure. Question 236. Histamine receptor antagonists result in A. decreased amounts of gastric juices. B. a low pH of stomach content. C. increased GI motility. D. decreased GI motility. The correct answer is decreased amounts of gas. Question 237. Histamine receptor antagonists are given A. with food or milk. B. and an empty stomach. C. with antacids. D. after meals. The correct answer is with food or milk. Question 238. Which is A. H2 receptor antagonist? A. Tagemet. B. Maalox. C. Mylanta. D. Phillips milk of magnesia. The correct answer is Tagemet. Question 239. Gastrointestinal prostaglandins. A. form a substance that adheres to the crater of an ulcer. B. stimulate GI movement and motility. C. block the action of histamine. D. inhibit gastric secretion. The correct answer is inhibit gastric secretion. Question 240. Which is a gastrointestinal prostaglandins? A. D-gel. B. cimetidine. C. cytotec. D. carafate. The correct answer is cytotec. Question 241. Which is not a proton pump inhibitor? A. Pepsid. A. C. B. Nexium. C. Prilosec. D. Prevacid. The correct answer is Pepsid. A. Question 242. When giving a proton pump inhibitor, the dose form A should be swallowed whole. B. can be opened. C. can be crushed. D. can be chewed. The correct answer is should be swallowed whole. Question 243. Coating agents can cause A. diarrhea. B. heartburn. C. constipation. D. urinary retention. The correct answer is constipation. Question 244. Metoclopramide is given A. 30 minutes before meals and at bedtime. B. with food or milk. C. on an empty stomach. D. after meals. The correct answer is 30 minutes before meals and at bed. Question 245. The effects of antispasmodic agents occur A. in the esophagus. B. in the stomach. C. in the intestines. D. throughout the body. The correct answer is throughout the body. Question 246. Antispasmodic agents result in A. decreased gastric juices and decreased GI mobility. B. increased gastric juices and increased GI mobility. C. decreased amounts of histamine. D. increased amounts of histamines. The correct answer is decreased gastric juices and decreased GI mobility. Question 247. Which is an antispasmodic agent? A. Acefex. B. atropine. C. Riopan. D. Zantac. The correct answer is atropine. Question 248. Which can cause a chalky taste in the mouth? A. antacids. B. coating agents. C. antispasmodics. D. gastrointestinal prostaglandins. The correct answer is antacids. Question 249. Which can cause mental disturbances? A. antacids. B. coating agents. C. antispasmodics. D. gastrointestinal prostaglandins. The correct answer is Question 250. Emesis means A. diarrhea. B. constipation. C. retching or griping. D. vomiting. The correct answer is vomiting. Question 251. Drugs that cause bowel evacuation are called A. Antidiarrheals, B. Antiemetics, C. Laxatives, D. Enemas. The correct answer is laxatives. Question 252. Which is a phenothiazine used to control vomiting? A. Prochlorperazine, B. Haloperidol, C. Trimethobenzamide, D. Dimenhydrinate. The correct answer is prochlor. Question 253. Which is often used to control motion sickness? A. Prochlorperazine, B. Haloperidol, C. Trimethobenzamide, D. Dimenhydrinate. The correct answer is dimenhydrinate. Question 254. Benzodiazepines are used to prevent nausea and vomiting from chemotherapy because they also A. Control diarrhea, B. Reduce anxiety, C. Improve alertness, D. Improve memory. The correct answer is reduce anxiety. Question 255. Stimulant laxatives A. Cause an irritation that promotes peristalsis, B. Draw water into the intestine, C. Contains oils, D. Draw water into the feces. The correct answer is cause an irritation that promotes peristalsis. Question 256. Which maintain fluid and electrolyte balance? A. Androgens, B. Estrogen, C. Glucocorticoids, D. Mineralocorticoids. The correct answer is mineralocorticoid. Question 257. Which have anti-inflammatory, anti-allergenic, and immunosuppressant activity? A. Androgens, B. Estrogen, C. Testosterone, D. Mineralocorticoids. The correct answer is mineralocorticoids. Question 258. Oral glucocorticoids are given A. Before meals, B. With meals, C. After meals, D. At bedtime. The correct answer is with meals. Question 259. Corticosteroids may cause signs and symptoms of A. Electrolyte imbalance, B. Masculine characteristics, C. Infection and inflammation, D. Allergies. The correct answer is electrolyte imbalance. Question 260. A person has a history of mental health problems. Behavior changes may occur when taking A. Corticosteroids, B. Estrogens, C. Progestins, D. Androgens. The correct answer is corticosteroids. Question 261. Estrogen may be used in the treatment of the following except A. Menopause, B. Some types of breast cancer, C. Advanced prostate cancer, D. Endometriosis. The correct answer is endometriosis. Question 262. Progestins are used for the following except A. Breast cancer and postmenopausal women, B. Contraception, C. Endometriosis, D. Abnormal uterine bleeding. The correct answer is breast cancer and postmenopausal. Question 263. Male hormones are lacking. What is this called? A. Androgen deficiency, B. Eunuchism, C. Hypogonadism, D. Priapism. The correct answer is eunuchism. Question 264. Contraceptives are used to A. Prevent pregnancy, B. Treat BPH, C. Treat erectile dysfunction, D. Prevent leukorrhea. The correct answer is prevent pregnancy. Question 265. Combination oral contraceptives contain A. Estrogen only, B. Progestin only, C. Estrogen and progestin, D. Progestin and testosterone. The correct answer is estrogen and progestin. Question 266. Combination oral contraceptives are packaged with 28 tablets. The last 7 contain A. Estrogen, B. Progestin, C. Testosterone, D. No hormones. The correct answer is no hormones. Question 267. Mini pill oral contraceptives are packaged with 28 tablets in which all contain A. Estrogen, B. Progestin, C. Testosterone, D. No hormones. The correct answer is progestin. Question 268. Which oral contraceptive results in 4 periods in 1 year? A. Monophasic, B. Biphasic, C. Triphasic, D. Seasonally. The correct answer is seasonally. Question 269. The following are side effects of contraceptives, which may signal serious problems. A. Weight gain, B. Breakthrough bleeding, C. Leg pain, D. Vaginal discharge. The correct answer is leg pain. Question 270. A transdermal contraceptive can be applied to the following areas except A. Breast, B. Arm, C. But D. Abdomen. The correct answer is breast. Question 271. Tamsulosin is used to treat BPH. It A. Cause muscles to relax so blood can fill erectile tissue, B. Causes muscles to relax to allow greater urine flow, C. Reduced cell growth, D. Inhibits estrogen secretion. The correct answer is causes muscles to relax to allow greater urine. Question 272. Which drug is not used to treat erectile dysfunction? A. Tadalafil, B. Vardenafil, C. Finasteride, D. Sildenafil. The correct answer is finasteride. Question 273. Cystitis is an inflammation of the A. Bladder, B. Kidney, pelvis, C. Prostate, D. Urethra. The correct answer is bladder. Question 274. Which does not occur in OAB syndrome? A. Urgency, B. Frequency, C. Incontinence, D. Diuresis. The correct answer is diarrhea. Question 275. Drugs given for OAB syndrome can cause A. Numbness and tingling in the arms and legs, B. Rust brown to yellow urine, C. Dry mouth, constipation, and blurred vision, D. Hematuria and nocturia. The correct answer is dry mouth, constipation, and blurred. Question 276. 2 types of eye drops are ordered. You apply the first type. How long do you wait for the second? A. At least 5 minutes. B. 1 hour. C. 30 minutes. D. A few hours. The correct answer is at least 5 minutes. Question 277. A person has glaucoma. The goal of the drug is to A. Prevent infection. B. Reduce intraocular pressure. C. Reverse blindness. D. Restore normal vision. The correct answer is reduce intraocular pressure. Question 278. Cholinergic agents and cholinesterase inhibitors may cause A. Increased intraocular pressure. B. Infection. C. Problems seeing at night. D. Kidney failure. The correct answer is problems seeing. Question 279. Adrenergic agents A. Dilate pupils. B. Increase intraocular pressure. C. Cause problems seeing at night. D. Cause heart failure. The correct answer is dilate pupils. Question 280. Beta-adrenergic blocking agents A. Decrease intraocular pressure. B. Increase intraocular pressure. C. Dilate pupils. D. Constrict pupils. The correct answer is decrease intraocular pressure. Question 281. Prostaglandin agonists A. Decrease intraocular pressure. B. Increase intraocular pressure. C. Dilate pupils. D. Constrict pupils. The correct answer is decrease intraocular pressure. Question 282. Anticholinergics A. Lubricate the eyes. B. Prevent infection. C. Cause problems seeing at night. D. Cause sensitivity to bright lights. The correct answer is cause sensitivity to bright lights. Question 283. Corticosteroids are used A. To increase intraocular pressure. B. To decrease intraocular pressure. C. Before and after cataract surgery. D. To treat allergic reactions of the eye. The correct answer is to treat allergic reactions of. Question 284. Artificial tears are used to A. Treat allergies. B. Dilate the pupils. C. Constrict the pupils. D. Lubricate the eyes. The correct answer is lubricate the. Question 285. Which is not a warning sign of cancer? A. Painful, swollen joints. B. A sore that does not heal. C. Unusual bleeding or discharge. D. Discomfort after eating. The correct answer is painful, swollen joints. Question 286. Chemotherapy is most effective A. When the tumor is first diagnosed. B. After surgery. C. After radiation. D. When the tumor is small. The correct answer is when the tumor. Question 287. A person receiving chemo will likely experience A. Diarrhea. B. Burn. C. Skin breakdown. D. Weight gain. The correct answer is skin breakdown. Question 288. An involuntary muscle contraction of sudden onset is called A. Clonus. B. Hyperreflexia. C. Spasm. D. Jerk. The correct answer is spasm. Question 289. The rapidly alternating involuntary contraction and relaxation of the skeletal muscles is called A. Clonus. B. Spasm. C. Jerking. D. Hyperreflexia. The correct answer is clonus. Question 290. Centrally acting skeletal muscle relaxants act A. Directly on the muscles. B. Depressing the CNS. C. Inhibiting reflex activity at the spinal cord. D. By blocking nerve impulses. The correct answer is depressing the CNS. Question 291. All centrally acting skeletal muscle relaxants cause some degree of A. Confusion. B. Orthostatic hypotension. C. Sedation. D. Spasticity. The correct answer is sedation. Question 292. The goal of therapy for central acting muscle relaxants is relief of A. Clonus. B. Muscle spasm. C. Jerking. D. Hyperreflexia. The correct answer is muscle spasm. Question 293. Which has a dose form of orally disintegrating tablets A. Dantrolene. B. Baclofen. C. Carisoprodol. D. Tizanidine. The correct answer is baclofen. Question 294. Which is not a centrally acting muscle relaxant? A. Dantrolene. B. Cyclobenzaprine. C. Methocarbamol. D. Carisoprodol. The correct answer is dantrolene. Question 295. Direct-acting skeletal muscle relaxants decrease A. Clonus, hyperreflexia and muscle spasm. B. Cerebral palsy and multiple sclerosis. C. Spinal cord injury. D. Photosensitivity, sedation, and drowsiness. The correct answer is clonus, hyperreflexia and muscle spasm. Question 296. Allopurinol is given for gout. The initial adult dose is A. 100 mg. B. 200 mg. C. 300 mg. D. 400 mg. The correct answer is 100 mg. Question 297. Persons receiving drug therapy for gout should be observed for A. Dysrhythmias. B. Tremor. C. GI symptoms. D. Confusion. The correct answer is GI symptoms. Question 298. Microbes that grow in living cells are called A. Bacteria. B. Fungi. C. Germs. D. Viruses. The correct answer is viruses. Question 299. Plants that live on other plants or animals are called A. Bacteria. B. Fungi. C. Germs. D. Viruses. The correct answer is fungi. Question 300. Chemicals that eliminate pathogens are called A. Antibiotics. B. Antimicrobials. C. Antivirals. D. Non-pathogens. The correct answer is antimicrobial. Question 301. A person with a weakened immune system develops an infection. It is caused by a non-pathogen. The person has A bacterial infection, B, healthcare-associated infection, C, opportunistic infection, D, secondary infection. The correct answer is opportunistic infection. Question 302. A person is being treated for an infection. Another infection develops. This is called A bacterial infection, B, healthcare-associated infection, C, opportunistic infection, D, secondary infection. The correct answer is secondary infection. Question 303. To maintain blood levels of the drug, antimircabals are usually given A, at regular intervals, B, at the same times every day, C, every 6 hours, D, every 12 hours. The correct answer is at regular intervals. Question 304. Which is not penicillin? A, amoxil, B, cipro, C, pincipin, D, trimox. The correct answer is cipro. Question 305. A common side effect of penicillin is A, diarrhea, B, hearing loss, C, phototoxicity, D, tingling. The correct answer is diarrhea. Question 306. Antiviral drugs used to treat HIV also are used to reduce the frequency of A, Hep B, B, Hep C, C, opportunistic infections, D, secondary infections. The correct answer is opportunistic infection. Question 307. Nutrition is A, fats, protein, carbs, vitamins, and minerals, B, many processes involved in the ingestion, digestion, absorption and use of foods and fluid in body, C, my pyramid, D, balance between calories taken in and used in the body. The correct answer is many processes involved in the ingestion, digestion, absorption and use of foods and fluid in body. Question 308. Vitamin A is needed for A, vision, B, muscle tone, C, formation of red blood cells, D, healthy bones. The correct answer is vision. Question 309. Vitamin B12 is needed for A, nervous system function, B, growth, C, healthy eyes, D, digestive system. The correct answer is nervous system. Question 310. Vitamin K is needed for A, blood clotting, B, resistance to infection, C, healthy bones, D, protein metabolism. The correct answer is blood clotting. Question 311. Sodium is needed for A, blood clotting, B, bone and teeth health, C, thyroid gland function, D, fluid balance. The correct answer is fluid balance. Question 312. Which is needed for nerve and heart function? A, phosphorus, B, iron, C, iodine, D, potassium. The correct answer is potassium. Question 313. Enteral nutrition A, requires an ing tube, B, is given into a central venous site, C, is given in the GI tract, D, requires 4. The correct answer is given in the GI. Question 314. For a tube feeding, the person is positioned in A, Fowler's or semi-Fowler's position, B, left-lying, C, right-lying, D, supine. The correct answer is Fowler's or semi-Fowler's position. Question 315. Which is an oral nutritional supplement? A, Ensure, B, LOC, green tea, D, St. John's wort. The correct answer is Ensure.